Hey, this is Cohl from Craven Sports, checking back in on our video series on sciatica. Previously, we talked about the definition, anatomy, and typical presentation of sciatica. Next, I thought we'd get in some video on a little bit of insight of what a typical therapy session might look like as far as treatment and management and so forth. These interventions will vary depending on your presentation and the therapist's skill sets and biases, but we'll take a look at a few of these right now. Okay, so looking at a couple soft tissue treatment options here, we have Angela kindly being our model for this. First thing I thought I would show is a active release for a hip flexor. So someone's got something that is either some symptoms across the front of the hip or some tightness that's pulling their back into certain situations. This is a great technique. So we would start with some firm pressure down into the front of the hip area, up into the stomach potentially. And then from there, Angela, you okay there? I get you to slowly straighten out that leg, holding that pressure down. As she slides that leg out, we just kind of keep that firm pressure and can often cause that muscle to lengthen out or relax a little bit. Good. And come on. Another example of a soft tissue cell treatment that might be used would be a trigger point of release and stretching for quadratus lumborum here. So Angela, just get you to straighten out your top leg for me. Bend up the bottom leg a little bit. Just bend up the bottom. Perfect. And then just set that back down. Kind of pressing in through the side, finding usually some uncomfortable areas and kind of holding pressure on that. Eventually we'll feel that kind of let go a little bit. And then from there we can do a little bit of stretching combined with some breathing. So Angela, if I can get you to take a really nice big breath in and then out, in, kind of stretching a little bit further on each breath. We may also be looking at doing something like a muscle energy stretch, so we can look at stretching out the side of the hip or the glute there. Bring your leg across here. So again, just taking it up into stretch position. You okay there? Okay. So when I ask you to, I'll get you to kind of push your leg back into me, just firm enough that we kind of meet pressure there. So push and hold. That's it. Keep holding. We're going to hold this for about 7 seconds. And then go ahead and relax. And then we'll try and use that contraction to allow us to sink a little bit further into the stretch. All right, moving on from the soft tissue treatments to looking at more of a joint mobilization or a position that can be taken into a manipulation if necessary. So this is looking more at the mechanics of the joint, the capsule, maybe some of the smaller muscles in that region as well. So patient's job on this one's pretty easy. It's just to let me know if there's any sharp or uncomfortable pains. Otherwise, just try and relax. And then we would try and be a little bit more specific and mobilizing into hopefully one or two segments at a time, working our way through. And something that may look like that. Another example that might look at restoring some stiffness at that end range extension position, again looking at more of the articular system, might be a mobilization in more of an end range position. So Angela, I'm just going to get you to kind of press up into that lazy push-up position, and then from there we make him into mobilize that joint once it's in that end range position. All right, so from an exercise standpoint, things will vary significantly depending on the individual's presentation, as I said, but the most common things you'll see for disc injuries will be extension-based exercises, shift corrections, and maybe some dural flossing or looking at some nerve mobility, which would look to address more of the specifics of the disc and nerve mechanics. Additional exercises maybe focus on trying to correct some of the contributing factors such as hamstring mobility, hip mobility, or potentially movement awareness in that sense. For individuals with more of a lumbar stenosis presentation, often, again, forward flexion is more of a decompressive position for them to try and offload that area. So that exercises surrounding that will be quite popular and effective. With other exercises looking at contributing faults, which may look at kind of hip flexor length, thoracic mobility, or even postural awareness. One common problem in basic movement patterns has to do with gripping or a tendency of tipping toward more of our lordotic or extended arched position of the back. Obviously, strength is another important factor that would need to be addressed, whether that's looking at core specifics or looking at loading more traditional exercises like squats and deadlifts. Core specifics might be something traditional like a plank, or it might be looking at something less traditional that you might not think of as being a core exercise, like a one-armed row from a lunge position or so forth. And then, although things like squats and deadlifts might sound like scary terms, especially to some individuals in the elderly populations and so forth, that doesn't necessarily mean that we're going to be putting a big heavy bar on your back or having you lift something really heavy, and it would be tailored to the individual, which again may just be as simple as learning how to get up from a seated position and so forth, or doing a hip hinge holding a broomstick or something like that. Thanks for checking back in. I hope the little look into what a typical physical therapy appointment for those individuals with lower back pain or sciatica would involve, and I hope that answers some questions that you may have, or set up some expectations going into a potential appointment. You can check back in here shortly. We're going to look at another video that might answer some common questions or debunk a few myths that might be out there in the general population in regards to low back pain, sciatica, disc injuries, and so forth. So, thank you.